In this video, we'll discuss mental illness, the definition and examples. Mental illness is a psychiatric disorder that results in a disruption in a person's thinking, feeling, moods, and ability to relate to others. Signs of mental illness could include feeling sad, confused thinking or reduced ability to concentrate, excessive fears or worries, extreme mood changes, withdrawal from friends and activities, or significant tiredness, low energy, or problem sleeping. It could also include detachment from reality, which could be delusions, paranoia, or hallucinations, your inability to cope with daily problems or stress, feelings of guilt, alcohol or drug abuse, and eating habits. It could also include excessive anger, hostility, or violence, suicidal thoughts, and sometimes symptoms of a mental health disorder appear as physical problems, such as abdominal pain, back pain, or headaches. There are two types of mental disorders. Anxiety disorders are a group of illnesses that have persistent feelings of tension, uneasiness, or apprehension, plus physical symptoms. Mood disorders are disorders in which a person undergoes mood changes that seem inappropriate or extreme. Anxiety disorders. General anxiety disorder is when a person will feel anxious, upset, and fearful for no apparent reason. These symptoms include problem sleeping, panic attacks, self-doubt, loss of memory, and concentration. Obsessive compulsive or OCD, a disorder where a person can't keep certain thoughts or images out of their mind. Persistent thoughts or behaviors, performing a task over and over again, for example, washing their hands, routine changes cause stress, and overly concerned with orderliness or organization are all symptoms. Phobia is an exaggerated fear of something specific. The symptoms include going to extreme measures to avoid fear and reacts in ways that limit normal function. Examples: claustrophobia, which is the fear of small places, arachnophobia, pyrophobia, zoophobia. Post-traumatic stress disorder is a condition where a person experiences a traumatic event and feels a lasting effect. The symptoms include bad dreams, feelings of guilt, insomnia, and severe reactions to images or pictures. Mood disorders. Clinical depression is a condition of sadness or hopelessness that lasts over a period of time. The symptoms include eating problems, weight loss or gain, thoughts of suicide, loss of interest in friends and hobbies, and irritability. Bipolar or manic depressive is a condition of extreme mood swings for no reason. A person will have lots of energy or no energy and will behave normally in between. The symptoms include feeling extremely happy or irritable and thoughts of suicide. Seasonal affective disorder, or SAD, is a person can experience depression during the darker or winter months. Symptoms are sluggish, fatigue, irritability, and trouble concentrating. Suicide, act of intending to harm or kill oneself. The symptoms: talking about death, giving away of possessions, sadness, loneliness, getting involved with drugs and alcohol, and making dangerous decisions. However you feel, no matter how you feel, there will always be someone that can help you. If you are having any of these thoughts, please speak to an adult. You can turn to a psychiatrist who is a licensed physician who can prescribe medication and can have people admitted to hospitals. A psychologist is a health professional who is a doctor in counseling or clinical psychology. They are trained in various types of therapy. A social worker is a health professional who has a master's degree, a profession or work of providing people in need with social services. A counselor is a health professional with a master's degree in counseling or psychology, somebody who helps others with personal, social, or psychological problems. If you are having these feelings, please speak to somebody immediately.